Let's talk about stress urinary incontinence. Urinary incontinence is unintentional passing of urine. It is a common problem and thought to affect millions of people. Urinary incontinence can be of several types, such as urge incontinence, when urine leaks as you feel a sudden intense urge to pass urine or soon afterwards. Stress incontinence is when urine leaks out at a time when your bladder is under pressure, for example, when you cough or laugh. Overflow incontinence is when you are unable to fully empty your bladder, which causes frequent leaking. Let's talk a bit more about stress urinary incontinence. Stress incontinence is leaking of small amounts of urine during activities that increases pressure inside the abdomen and push down on bladder. What are the different causes of stress incontinence? In women, stress incontinence can be caused by pregnancy, childbirth, and menopause, whereas in men, it may develop after prostate surgery. Now, let's look at some of the facts and figures. It is thought that about 16 to 20% of female in Australia are affected by stress urinary incontinence, and most of them being in middle age, that is between 35 to 44 years. Surprisingly, only 25% of women with incontinence seek help. Let's talk about some of the signs and symptoms. Urine leaks when bladder is under sudden extra pressure, and some of the activities that may cause urine to leak, such as sneezing, laughing, heavy lifting, exercise, and sports. Amount of leak is usually small, but there could be a larger amount of leak if bladder is very full. Now, let's talk about taking the first step and seeking help. Where to go if you need help? You can always talk to your general practitioners. General practitioners can assess, diagnose, and treat incontinence. Continence Nurse Advisor. A continence nurse advisor is a registered nurse with extensive training in continence care. They are able to assess your condition and work with you to develop a management plan to suit your needs. You can also go to a physio, that is continence and a woman's health, or a pelvic floor physiotherapist or a physiotherapist who has a special interest in continence and women's health or pelvic floor issues. They can assess your pelvic floor function and tailor an exercise program to meet your specific needs. Alternatively, you can also call National Continence Helpline. Depending upon the severity of your symptoms, treatment can be conservative and may involve lifestyle changes, pelvic floor muscle training, and in severe cases, medication or surgical interventions may be considered. Furthermore, research suggests that with proper pelvic floor muscle training, 66% of patients recovered with no side effects. That means no leak. Thank you for listening. And if you liked it, please do feel free to share it.